Have you ever been in a situation where your heart raced, palms sweated, and your thoughts raced? If so, it may have been an encounter with anxiety. It can be as if you are in a room with walls closing in, where it's difficult to breathe. Your mind may be a whirlwind of thoughts and chaos. This is what anxiety can feel like, what it can do, and how it's more than just a word. In this video, we will look at the many faces of anxiety, the different ways it manifests, and how it can affect mental health. We will learn about the symptoms, the different types of anxiety disorders, and the myriad effects it can have on one's mental health. We will also delve into various treatment options and strategies, and the importance of seeking professional help when needed. Anxiety is more than just feeling stressed or worried. It's a relentless wave of unease that can control your thoughts and actions. It's like having a constant, uninvited guest in your mind, weaving a web of worry that can leave you feeling trapped. Let's take Josh, a university student, as an example. Josh was a great student, always punctual, always prepared. But one day, during a particularly tough exam, he experienced something he'd never felt before. His heart pounded like a drum, his palms were clammy, and he felt a sudden rush of fear that made it impossible to concentrate. He was having a panic attack, a form of anxiety. Anxiety isn't just the nervousness you feel before a big presentation or the butterflies in your stomach on a first date. It's an intense, overwhelming feeling of fear and dread that can strike at any time, often without any apparent reason. It's not just a single moment of stress, but a lingering state that can last for hours, days, or even weeks. And yet anxiety is often misunderstood. It's not about being weak or oversensitive. It's a real, tangible issue that affects millions of people around the world. It can affect anyone at any age, from any walk of life. Like Josh, many of us might have experienced anxiety without understanding what it was. But with knowledge and understanding, we can begin to untangle the web of worry and reclaim control over our minds. Anxiety doesn't just appear out of the blue. It usually has a trigger. Let's look at some common triggers for anxiety, such as stress, trauma, and health issues. Consider the case of Emma. She is a university student, managing her studies and social life effectively. However, she started experiencing anxiety after a distressing car accident. The trauma of the accident was a significant trigger for Emma's anxiety. The sudden, intense fear she experienced during the crash lingered, morphing into a constant state of worry about future potential dangers. This is often the case with traumatic events. They can create a lasting impression on our mental state, leading to anxiety. Health issues can also play a role in triggering anxiety. For instance, chronic illnesses, or even just fear of falling ill, can induce anxiety. Stress, too, is a common trigger. Daily stresses, such as work deadlines or financial worries, can pile up, leading to feelings of anxiety. Identifying triggers, like Emma did, can be a crucial step in managing anxiety. Anxiety can manifest in many ways, and it's different for everyone. Let's take Sam as an example. Sam found it increasingly difficult to fall asleep at night. Hours would tick by, and despite his exhaustion, his mind was a whirlwind of thoughts, worries, and scenarios playing out over and over again. This is insomnia, a common symptom of anxiety. Sam also noticed a constant sense of worry. Whether it was about work, relationships, or even just daily tasks, he was always anticipating the worst possible outcome. This perpetual state of worry is another typical symptom of anxiety. Other symptoms may include restlessness, a feeling of being on edge, increased irritability, and difficulties concentrating. Some people might also experience physical symptoms, such as an increased heart rate, rapid breathing, or gastrointestinal problems. Recognizing these symptoms, like Sam, can be the first step towards seeking help. Anxiety is not just one size fits all. It comes in different forms. One such form is generalized anxiety disorder, or GAD. GAD is characterized by persistent and excessive worry about several different things. People with GAD may anticipate disaster and may be overly concerned about money, health, family, work, or other issues. For example, Lisa is a high achiever, always pushing herself to excel in her career. But she constantly found herself in a state of worry, often feeling restless and on edge. She found it hard to control her worry, even about the smallest things. After consulting with a mental health professional, Lisa was diagnosed with GAD. There are also other forms of anxiety disorders, such as panic disorder, social anxiety disorder, and specific phobias, each with their distinct characteristics and symptoms. Understanding these disorders can help us better manage our anxiety. Anxiety doesn't just affect us physically, of course, but mentally as well. For the most part, David is just like any one of us, with hopes and dreams and aspirations. But David suffers from chronic anxiety. Over time, this unrelenting anxiety began to cast a shadow over his general mental well-being. David's constant worry and fear started to feel overwhelming, almost like a heavy weight that he carried around all the time. This perpetual state of anxiety began to tire him out, affecting his ability to concentrate, make decisions, or even enjoy the simple pleasures of life. It was like a fog that wouldn't lift, obscuring the joy and color from his world. As time passed, David noticed that his feelings of anxiety were often accompanied by a sense of sadness and hopelessness. He was slipping into depression, a common companion of chronic anxiety. This dual burden of anxiety and depression made it even harder for David to cope. His mental health was on a downward spiral, and he was losing the zest for life that once defined him. It's important to remember that David's story isn't unique. Anxiety can and often does lead to other mental health issues. It's a domino effect that can topple even the strongest among us. Like David, many people with anxiety also struggle with other mental health issues. The good news is, anxiety is treatable and manageable. There are various treatment options and coping strategies available, and it's all about finding what works best for you. Let's take a look at the case of Anna, who found relief through cognitive behavioral therapy and mindfulness practices. Anna lived with anxiety for many years. Feeling constantly on edge, she struggled to maintain her daily routine. She decided to seek help and found a therapist specializing in cognitive behavioral therapy, or CBT for short. CBT is a type of psychotherapy that helps people identify and change thought patterns that lead to harmful behaviors and emotions. In her sessions, Anna learned to recognize her triggers and understand the thoughts that led to her anxiety. Her therapist guided her in challenging these thoughts, replacing them with more positive and realistic ones. This didn't mean ignoring the fact that life can be challenging, but rather learning to approach these challenges in a healthier way. Alongside CBT, Anna also began practicing mindfulness. This included techniques like meditation and deep breathing exercises. Mindfulness is all about staying present, focusing on the here and now, rather than worrying about the past or future. For Anna, it helped her to gain a sense of control over her thoughts and feelings. These strategies worked for Anna, but it's important to note that everyone's journey with anxiety is unique. What worked for her might not work for everyone. Other treatment options could include medication, lifestyle changes, or other forms of therapy like exposure therapy or dialectical behavior therapy. The key is to not lose hope. It's okay to try different methods until you find what works best for you. Remember, seeking help is a sign of strength, not weakness. It's about taking control of your life and making the decision to feel better. Just like Anna, you too can find strategies that work for you. You don't have to face anxiety alone. Help is available. There is real strength found in reaching out when you're feeling anxious. You see, professional help is not a sign of weakness, but an important step towards taking control of your life. Psychologists and psychiatrists have the training and knowledge to help you understand and manage anxiety. They can guide you through various coping strategies, provide emotional support, and, if necessary, prescribe suitable medication. There are also several resources available online. The Psychology Ponderings page of deltapsychology.com may be helpful. Remember, it's okay to seek help. You're not alone in this journey.